Join Dr. Coffee Brown to discuss what's new in health and medicine. Dr. Brown and his guests explore the latest research and technology in health and medicine to help us understand how it affects our lives. Then they provide takeaways and steps we can take to improve our own health and the health of our planet in the future. We're glad you're here to take part in the conversation. In this episode, Dr. Coffee Brown's guest is Dr. Rebecca Fastle, a UNM professor in pediatrics and emergency medicine. Dr. Fastle is the officer tasked with managing transfers at the state and university level among ICU beds. Tonight, we're going to focus on the impact of the unvaccinated on non COVID patients, the healthcare system and caregivers, as well as the dangers to children. Thanks for joining us today. And now, back to our host, Dr. Coffee Brown.
Thank you, Shelley. I'm really looking forward to tonight's conversation because Dr. Rebecca Fastle is both a friend, but somebody I greatly admire in the emergency medicine field as well. She's a pediatrician and she's an emergency medicine physician, and she's both a state and university officer tasked with managing the transfer of patients among ICU units, something we normally prefer not to do at all, but can be necessary when everybody's overwhelmed. And last time we spoke, all the ICUs in the state were overburdened at a rate of 120 to 160%. These are three among the effects of the slowing down of the vaccination rollout between the changes caused by the Delta virus and the vaccine hesitant. We're still seeing more of a pandemic than we should be, and the people at risk is an expanding population. Maybe a good way to drive that point home, Dr. Fastle, would be the impact on children of the Delta virus.
Thank you, Dr. Brown, and I appreciate you having me here this evening. I think that, as a pediatric emergency medicine physician, pediatrician, I am particularly interested in the impact of the COVID-19 pandemic on children and families. In our community, we have seen children affected in both direct and indirect ways. So as a community, we initially with the pandemic, children were really not affected very much other than to be pulled from school across the country. About 93% of children had at least some at home or remote learning. In New Mexico, it was pretty much 100% of our students throughout the 2020 school year. This had huge impacts. We have an incredibly poorly resourced community, and a lot of those kids rely on the school system for social support, for food, for safety. And then women were disproportionately pulled from the workforce to take care of these children to help them with their school needs. As the Delta variant has surged, about 25% of new cases are in children. Children still are tolerating the virus pretty well. There, across the country, there's been about 4,400 cases of what's called MIS-C, which is multi-inflammatory syndrome in children. This is a very intense inflammatory process that generally occurs somewhere between 4 and 6 weeks after a child has had COVID, and they may have been completely asymptomatic from COVID and still experience MIS-C. There's been about 37 deaths from that. So although that MIS-C is rare, it's something dangerous that we look for. Probably on a more global level, we have experienced, children have experienced being orphaned as a result of COVID. So across globally, there's been about 1.5 million children that have been orphaned, and a great percentage of those are in communities that have very low vaccination rates and have huge incidence with COVID. So poor resources, and really impacts these children dramatically. In the United States, about 114,000 children have been orphaned as a result of COVID.
And a big part of the theme tonight is kind of these spin-off effects. So the abuela, the grandmother, dies of COVID. Now there's no caretaker. Mom has to leave work for some indeterminate period of time to stay home and be a caretaker for a moderately or severely ill child, or simply a child who's lost their grandparent caretaker. And then when mom tries to rematriculate from the workforce, her career has been set back in a way that it potentially may never recover from, or she may have trouble reentering the workforce because the jobs that are open now are high tech, but most of the unemployed are low tech. And so there's a big mismatch between the available jobs and the available workforce. We'll talk about excess deaths in a little bit, but these ripples outward of consequences from this pandemic, I think, are not getting reported on enough.
No, I agree with you, and I think it's so important that you bring this up. A person coming from even families that have been allowed to work remotely, they still have, when you look at young children that have I've looked at schedules of elementary school children trying to do learning online. We take a 15-minute break. Now go to your math class. Now do this. Now do that. Now have a lunch break. It's nearly impossible for the person to be working remotely and trying to manage that online schooling effectively. So it's really been a traumatic experience for our communities.
You know, the number of children who are significantly harmed initially by COVID is comparatively small compared to adults, but much more so than it was early in the pandemic. The percentages are higher. And also, some of the mild early cases can go on to become long hauler cases as well. But especially, what's hurting a lot of these kids is the vaccine hesitance. They don't want to get vaccinated because they've heard of like the blood clots with one of the vaccines. There were 6 blood clots out of 7 million injections, of whom one died. The odds of your child dying, even from an unlikely complication like this pediatric inflammatory syndrome, which causes blood clots, can lead to strokes and permanent crippling. The odds of that are orders of magnitude greater than the odds of a complication from the vaccine. And yet people fear the vaccine enough to put their own children in danger. What do we do about all that?
No, I think that's a very, very important and challenging issue to address. There are many parents have come in extremely concerned about the vaccine and what do they do about it, and when should they get the vaccine. And I encourage them, you need to get the vaccine. I think that one of the things that we have seen as a result of COVID, both the direct and the indirect, is the psychological impact on our children. So the inability to go to school, the inability to play in sports, to connect with friends. And we've seen a huge increase in depression and suicide attempts. And then when you look at the impacts of COVID, about 7% of people who have COVID, including children, will end up with brain fog or fatigue or depression and anxiety that are related to the long haul effects of COVID. And so I think it's very, very important that parents understand the facts of the vaccine, the safety profile of the vaccine, and really make every effort to have their children vaccinated. It will become easier when the FDA approves it in children 12 to 18. I think then we have a little bit more push that we can make for those children to become vaccinated.
Now, Dr. Fastle, you are a parent and an educator and a pediatrician and an administrator trying to juggle this overload. Do you think schools should be open without restriction, open with some restrictions, remain on as much remote learning as possible for now? If you got to write the rules, what do you think it might look like?
It's so difficult. My youngest daughter is 15. She's in 10th grade. She spent the entire 9th grade in remote learning. It's a painful process. I want her back in school. I want our children back in school. The only safe way to get our children back in school is to have people vaccinated. I still do feel that even in this climate that we are in now, that schools need to be open as much as possible, and that remote learning should be limited to children that have been exposed or have COVID and can possibly do remote learning at that point in time. But these hybrid models are very challenging. They're challenging for administrative school officials to manage and to grade children and that type of thing. And so It is a great question. I think we have a lot of thinking still to do around that issue, but I do think we need to make every effort to get our children back in school. That is one of our common grounds as parents that are vaccinated and those that are not. We all want our children back in a safe way, and so I hope that will be one of the impetuses that drive parents to become vaccinated and get their children vaccinated.
Even at the university level, I found online learning, uh, it didn't feel as like I could do my best work.
Mm-hmm.
But I will say that it turned out better than I was expecting, largely due to the fact that the students really committed to making it work. So I wanted to give a shout out to my university students who really went every extra mile to make sure they got good education in spite of these limitations. But all of them have told me they would prefer to go back to brick and mortar. I don't know if you can see what I'm seeing, Dr. Fastle, but there's a question. Are we effectively creating a COVID generation of children, and any sense of how that generation will be different? For example, kids whose moms were taken out of the workforce,
Mm-hmm.
those girls may grow up with less of a sense that they can choose a career for themselves because they haven't got the same role modeling at home.
Mm-hmm. I think that this is a great question. And when you look at even the differences from state to state, so for instance, a state that did completely remote learning and did not have any sports is going to have fewer children able to get sports scholarships than states that were completely open to sports. And so I think that impacts our children across state lines even. Even with my older daughters that are applying to medical school, they've not been able to shadow effectively because the New Mexico systems are closed down, and some other states may have a system opened up. Now, when you look at that, is that right or wrong? I think it's probably would have been nice if we could have come together as a country. And when you look at our vaccination rates, the high of 78% in Vermont and the low of 47% in Idaho, and you look at what Idaho is dealing with right now, and really and having to declare crisis standards of care and really limiting and rationing care, you have to ask yourself where do we draw the line as far as a public health crisis and what our children need, and what is a COVID generation? Is it children are comfortable wearing masks? Are they comfortable with online schooling? Are they comfortable with um, I would say that last year with my daughter in ninth grade was not as effective a year as she would have had if she had been in school. So are our children not going to have learned what they needed to learn to really move on to college? And there's some pretty precious years that are cost because of this.
Now, some states have made the choice that they're going to make school as normal as possible.
Mhm.
And if that means more people die, that's a reasonable trade off. So some states, like ours, chose to save lives now, but may experience some setbacks later. Other states chose to sacrifice citizens now, but may experience some benefits later. This creates one kind of differential. And one of the things you and I had talked about was communities that are differentially at risk from COVID. What do you know about that? What's the root cause of some of those differentials?
So I think that we need to consider disparities in access to care. So New Mexico is incredibly unique in that we have there's a lot of communities that have rural towns around them, but we're low resourced, a lot of rural towns, and access to care can be limited. This really disproportionately affected our Native American population early in the pandemic. And when you look at that more closely, it's like look at these patients, our Native American patients were coming in and dying. They died at a much greater rate than other populations. And was that because of lack of resources on the reservation itself with running water and electricity, a lack of computer access so that they were not getting the information they needed of who was a vulnerable and who needed to be protected? They're an incredibly rich community, and their elderly people are right there, right in the middle of the community. And so their elderly people were not separated. And that is a good thing in many, many ways, but that contributed to the deaths that they were experiencing and that we were experiencing as a community with those populations. The other thing you look at is the access to care. Are they able to get transportation? Do they have a primary care doctor? Do they have, when we went to telehealth medicine because clinics closed down, were people able to get into a telehealth appointment. And so those patients that have chronic diseases that are not able to access care on a regular basis were really marginalized much further. And we saw this across the country. We saw that groups of color and that the disparities in wealth really hit those communities much harder than it did others. So I think we're going to have a lot of significant issues to address as a healthcare system in our country related to this pandemic. It really will have opened our eyes to a lot of this. And New Mexico um, is one of those communities. And if I may, early on in the pandemic, the State Transfer Center, we were open as a transfer center. I'm one of the medical directors. I'm the University of New Mexico medical director. There were others from Loveless and Presbyterian as well that contributed to load leveling ICU resources. And early on in the pandemic, even in that peak in January, when it was really high numbers, we were able to pull from those communities. We were able to call Gallup and say, we see that you're overwhelmed. Let's take some of those patients here. This time we saw as a country, we saw with vaccinations the rate of COVID go down and people breathe a little easier and relaxed. So that in June, middle of June, there was about a 7-day average of about 12,000. By the end of July, that was 60,000. So we see that peak come up with the Delta surge that was tremendous. And what we saw all around us, because Texas was full, Arizona was full. Everybody was full. Nobody could any longer share with each other and help each other out. And what we saw as a state is, although we were not rationing care, we are not rationing care, but it's taking a lot longer to get the care that you need. And so that's costing us, and that's costing those communities that are in rural hospitals. We're not able to pull them into the fold as quickly as we were early on in the pandemic. And so those patients are suffering disproportionately, which was what we did not want. We did not want, no matter where you lived in New Mexico, we wanted you to have access to the same care as if you lived in the middle of Albuquerque. And that's just much more challenging to do at this point in time.
Dr. Fastle, I'm not going to put you on the spot by making this a question. I'm just going to make an observation. And that is, multiple states have made the conscious, very public choice that they like differential access to voting. And I have the sense that those same states are at least comfortable with differential access to care.
Mm-hmm.
And that bothers me a lot. Don't respond to that. You'll just put yourself on the spot. But
Yeah.
that is what I observe. And I'm not going to lie. I'm pretty upset about it.
Yeah.
So we've kind of managed to keep up with this, but as you say, care has been delayed. I think this segues into the well, before we go to that, there's a question here. In your opinion, Dr. Fastle, how much better or worse will the U.S. healthcare system be after the pandemic?
This is an incredible question, and I think it is so important. So let's look at this. So let's look at this as an opportunity. Where do we have the opportunities to improve our healthcare to all of our citizens, right? Where do we have the opportunity to improve disparities in healthcare? And so that will be something that we need to address as a country and as a community as a whole. Then let's take a look at the impact on our system, just this degrading, terrible situation that we have been in over the last year and a half. So early on, physicians, nursing, everybody was on board. Let's get to work on this. Let's get through this. Their vaccines were not an option. It was really just survival. Let's save as many people as we can and get them through this. And people are dying, and let's hold their hands and let's help get through this. And then we lost, hundreds of nursing staff, nursing and physicians. I had the number there. And then, healthcare providers across the country just looked at as heroes. And, what is the definition of a hero? It's a person that fixes things. They're courageous. They go up and beyond, and they go out and they save lives. And then over time, providers can't do that. The healthcare world can't do that. Then a vaccine became available, and then it created this incredible divide. And now nurses and physicians are getting, they're now villains, and nurses get like insulted and yelled at in grocery stores and things like that, as do providers. And it's very, very challenging. We anticipate that 20 to 30% of our workforce of healthcare providers are going to leave altogether, just not want to be here. So we are going to have to rebuild. We're going to have to rethink about what it is to be a provider and what do we expect during something like a pandemic. Can we really ask our nurses to go from 1-to-1 in a ICU setting to 6-to-1 and see patients die and say, well, you still have protections and you can do it. And no, you can't do it. You can't do it. And so this has been just a really rough time to be compassionate and not develop compassion fatigue and to stay invested. And when people don't want to get vaccinated and they're dying, to respect that it is still a choice. And so, it's a really difficult question to answer. I think right now we're where we have no beds and we don't have the capacity and everybody's tired. I would say that it's going to be a long haul to crawl out of this.
Some of the changes may be that we've certainly gotten a refresher course in how pandemics work, something that antibiotics had bought us a vacation from for a while. We sort of forgot how bad infectious diseases can be. Certainly my grandparents would have known all about this sort of thing, right? Any books that you read up until 1940, if there's an epidemic disease around, people knew exactly how to respond to it, and everybody took for granted that you responded in a community conscious way. Perhaps we can bring some of that back. That should be a value right and left can agree on, I would have thought. Another thing is that this has been obvious internally for a long time, but perhaps politicians and the public will become more aware that if you run the medical system, especially the front lines of the healthcare system, at 110% all day, every day, you can't accommodate a surge. And
Right.
we've seen that many, many times when there's a pileup on the freeway or, a mass shooting or things like that have overwhelmed the system multiple times. But now it's happening on a national and prolonged scale. And I think that having much more slack in the system than we have in the past only makes sense. Our modern system was reshaped drastically after World War II because it was seen as emergency preparedness. But we got fat and happy and comfortable and forgot that, and profits replaced sense in terms of overextending everybody on an all-day, everyday basis. Before the pandemic, I routinely saw people crying on their way out to their cars every day after work, just a daily event, not even enough to be an eyebrow raiser. That shouldn't happen in any job at all. So I would like to see us build a bigger, more robust system with room for people to take a breather and some fill-in when crises occur. But what's actually going to happen is that by the time we get to this pandemic, we're going to be down 30% and have a huge backlog of cases at the same time. And now I think it's a good time to explain for our listeners, what do we mean by excess deaths?
So great question. I think what we mean by excess deaths, so when there's been some studies that look, obviously there's been a lot of information that comes out related to COVID, but as COVID cases increased, people seeking medical care decreased. And so out of fear, there was about a 41% decrease in access of the emergency department, going to your primary care doctor, which a lot of them had closed temporarily. And so about a 41% decrease in access to care. And what that has led to is increase in cardiovascular disease, increase in disease from cancers and DKA and that type of thing. And so what we see is that above and beyond what COVID has caused, these patients that could not get resourced into care were dying.
So, yeah, it could happen that tomorrow I have a heart attack or a severe infection. I go to the hospital and what I need is an ICU bed. Nothing to do with COVID at all. I just got sick in the way that people get sick. But all the beds are full because of COVID. And so I languish in a hall in the emergency room long enough to die, potentially preventable death. So I, a person who got vaccinated and haven't had a whiff of COVID, die because somebody else didn't get vaccinated. That's a spin-off effect that I think is being underaccounted for. Also, we touched briefly on long haul. People should realize there's a whole lot more long haulers than there are deaths. We talk about deaths in a situation like this, but it's always the tip of the iceberg. Deaths are always a tiny fraction of the number of injuries and near misses that actually occur.
Right.
What about you? How do you feel going forward in medicine?
So I have two daughters that are applying to medical school, and I love what I do. I went into medicine to practice pediatric emergency medicine, and I've had the fortune to be kind of join the hospital administration team over the last couple of years, and I still feel like this has been incredibly challenging, but we are in this to care for each other and to care for our patients and to learn. And so uh, the one thing this pandemic will have done was allow us tremendous learning opportunities. So I don't discourage my daughters from going into medicine. We need a lot of people going into medicine, and I hope that we will rebuild our nursing staff and that those that are burned out and left prematurely will come back. And I am optimistic about where we're going as a country. We have a lot of changes and a lot of potential to make things better. And these disparities that are really slamming us in the face, we have an opportunity to change. And so I look forward to seeing where we go with that. I am an optimistic person.
Now, I'm sure some of the people that might listen to this discussion would say, yeah, they're taking the party line. They're big on vaccines. Sure, blame the unvaccinated. Why should I listen to them? For someone who is vaccine hesitant and doesn't, figure somebody like us is already taken aside, as it were, how would you recommend that people sort through information versus misinformation
Mhm,
in a way that where they can trust their own findings
mhm.
and we can trust that they have a reasonable chance of getting accurate information?
Yeah. So we are definitely in a culture right now that is incredibly divided and receiving very convincing information that is false or misinformation. And so, how do you tease out what is real and what is not real? And that's very very difficult to do. I think from what I do is I just chip away. I talk to people. I listen to them. I talk with them about the pros and cons. And I have a very good friend, very dear friend, who is in her late 60s, and we work together with horses. And we had this conversation last night because very incredibly hesitant about of getting a vaccine, and just talked for a long time about why I felt it was important, why I felt it was safe, what the science is behind it, and that I think she needed to be around for a lot longer. And I think that we need to respect where people are coming from, and that where this misinformation is really driven home, and it does us no good to say this is your fault. Now we're a pandemic of the unvaccinated. That's not helpful. I think we really need to have an open conversation and listen to where this information is coming from and how can we counter it respectfully and help guide people in their decision.
I agree. Some of the spreaders of misinformation, the sources of misinformation, have to know better. They have to be letting their egos override their training. But
Mhm.
many of the people who are consumers of that misinformation don't really have any reason. They don't know why pandemic is a complete work of science fiction, for example.
Yeah.
And it would take a lot of homework for them to answer that question. I would make the pitch, though, that at least my personal policy is I'll believe things that sound credible if the stakes are low. But the higher the stakes are, the more homework I do before deciding who I believe and who I don't believe.
Right. Right. Absolutely. But we are in an incredibly divided time. And some people have really felt that they're getting information from reliable sources that may be misinformation. And so that makes it very challenging.
Well, we are in the business of saving lives, and this
Mhm,
misinformation has made both
mhm,
our jobs and our mission in life
mhm,
much more difficult.
mhm.
I would say. Well, what else would you like to share with the public from your perspective?
Okay, first I need to clarify on my title. It's an associate professor in pediatric emergency medicine, and not professor. That's a big deal from the academic world.
Fair enough. Fair enough.
And then I just no, I really appreciate the opportunity to talk about this. From the State Transfer Center, this time around has been much more challenging, and so I would like people to be aware that we are doing everything we can to low-level ICU resources. And currently, some parts of our state are even up as high as 180 to 190% of their capacity, that we have lost nurses. We have the vast majority of our nursing staff and physicians are vaccinated, and the healthcare mandate that we have to be vaccinated in order to work in New Mexico or provide exemptions. But I think that people need to recognize that if they are not in the healthcare industry, they may not really see the full effect of this. And that when you're in the middle of this in the healthcare industry or working in a healthcare field, that you feel like it's just slapping you in the face all the time. So you feel like everybody must be seeing it and must know exactly how difficult and challenging it is. So I would just caution our listeners who have elected not to get vaccinated and who may get sick. And there are incredibly limited space available. And those people that are vaccinated and have other illnesses, like you talked about the collateral damage of this, that we are not able to provide the care that we ultimately want to provide. We're not rationing care, but we are still taking longer to get to people.
Yeah, and I would add to that that if people cannot convince themselves that getting vaccinated is safer than the disease itself. So nothing in life that I'm aware of is 100% risk-free. These vaccines are pretty darn close, but nothing that I know of is 100% risk-free.
Mm-hmm.
If they can't convince themselves that the vaccine is less risky than the infection, then I would at least say, if you're not going to get vaccinated, which I think is a terrible idea, but if you're not going to get vaccinated, then you need to really redouble things like masking and personal isolation, social distancing, hand washing. All the other things you can do to avoid getting infected become massively more important for you if you're not vaccinated. And the consequences, if you get this wrong, may be killing a loved one,
Right.
maybe killing a complete stranger, or it may be that when I need to go to the ICU, I die. And you've never met me, and maybe you resent what I'm saying right now, and that's okay with you. But I think it's important that a community worry about harming each other. I think that's not a political position. That's just human, I would hope.
Absolutely.
So any hope on the horizon?
I think there's always hope on the horizon. New Mexico has done really well, and I was looking at Idaho today, and what the governor was writing. You know, what their approach is quite different, and they're really dealing with some incredibly challenging times. And but the governor says, it really feels like a mandate is wrong, but strong encouragement for people to get vaccinated, that we know vaccines work. And so and what they're dealing with is just incredibly difficult. And so I think that there is hope that people will start to realize that vaccines do work, and that more of our young people are dying. That's the other thing that people need to realize, is that as far as the percentage of people that have been vaccinated, the age differentiates. So many of our very high risk population is vaccinated, right? Those patients that are 65 and older, many of those have elected to become vaccinated. And so now this last surge is affecting primarily unvaccinated individuals, and that tends to be a younger population. And so that tends to be those people in their 30s to 40s that are disproportionately affected by this now. And so we're seeing a changing demographic related to that.
Now that's interesting. So Dr. Fastle, trigger warning. This is actually something you and I don't see the same way, which I'm happy about because it can lead to a discussion. You've mentioned a few times now that you would be uncomfortable with vaccines being mandated. I would argue that, first of all, there's plenty of history for mandating vaccines, going all the way back to George Washington and smallpox. That one turned out to be true. He actually did mandate that his troops get vaccinated against smallpox. And of course, smallpox was killing a lot more soldiers than the fighting itself was killing. If I were to go outside in my front yard right now and fire a bunch of bullets up into the air, the police would arrest me because they're going to come down somewhere and they might hurt someone. And everybody I know would say, yeah, that's appropriate. What are you, crazy? That's reckless to walk out in your front yard and shoot bullets up in the air. Yet the risk of me harming someone that way seems a lot less than the risk of me harming someone by not getting vaccinated. So
Yeah.
why are vaccine mandates a special case, and why is it different now than it was in the formative days of this country?
That's a great question. And I'll just say for the record, I'm not really against mask mandates. I'm just not sure that it brings us all together as far as a mask mandate.
I worry about that too.
I
Vaccine mandates I'm talking about.
Right. Vaccine mandates, yes. So I will say that we appear to be in a very different time. This is an incredible public health crisis, this pandemic. And I could not have imagined that a public health crisis would not bring us all together, that it would divide us like this. And so I really do feel like there were opportunities early on to really help bring this together that did not take place. So that once the country was divided, the vaccine mandates are people feel more resentful of them, and we even see that with our with our healthcare staff, and that people rather leave the field than become vaccinated. Now in New Mexico that was a very small percentage, about 1%. In some other places it's higher than that. In New York it was like 16%, so like 83,000 of their nursing staff left in parts of New York. So I do think that we're in a little bit of a troubled time to have a vaccine mandate. And when you look at public health crisis in the United States over time, people in the past, the public health was mandated. You were required to do that. I mean, that's how we eradicated things like smallpox and tuberculosis and things along those lines. And this public health crisis is not bringing us together. And so I guess I'm concerned that it would create more of a wedge. Though I do feel like the private sector and people stepping up to that and saying we're going to mandate that our employees are vaccinated will help to take care of that and help bridge that gap because of where we are as a country. So is it the government's job for this mandate? And I would say in the past, absolutely. At this point in time, we seem to have crossed down this road too far to turn back to that. That's just my feeling.
That's a great answer, actually, Dr. Fastle. If I can summarize, the medical risk of not vaccinating hasn't diminished, but the social risk of mandates has increased due to the climate we're in right now, the social climate that we're in right now.
Yeah.
So it changes the risk-benefit ratio. That's a good point. That's the way a physician should think. It just makes me so sad, though. By some estimates, we could have reduced the death toll on Americans by as much as 90%, according to epidemiologists, had we responded in a more traditional way earlier on. I don't mean an innovative way. I mean just in traditional ways.
No, you're absolutely right. And then that aside, from the date that vaccines were available, if we had responded at that point as well, we could have potentially saved another 90 to 100,000 lives.
Well, they are here. They are helping a lot of the people that they are helping.
Yeah.
By the way, one thing I don't know, and I bet you do, clearly the vaccinated people are less likely to get the disease, and if they do, they're less likely to be symptomatic. Do we know if it diminishes the rate of long haul syndrome?
So I believe it does diminish the rate of long haul syndrome, but I don't know to what degree. I don't know to what degree. They are not getting as sick, but it's now we're finding that with different vaccinations, the hospitalization rates is about 86% unvaccinated versus vaccinated, and about 95% deaths. So we are seeing a little bit of breakthrough deaths and a little bit of breakthrough hospitalizations, even in vaccinated populations, because of this huge surge in the Delta variant.
Yeah, and we've talked about that, and I think about that a lot, that people, humans seem to have difficulty weighing a small risk against a big risk. They want absolute numbers one way or the other, but we don't get that in the real world. We have to weigh risks against each other. So we have to weigh big risk against small risk. And that's just something folks are going to have to get their head around, I think, in order for us to be able to have discussions around this. Comment, I don't know if do you see the comments when they come up, Dr. Fastle?
Yes, for to note that businesses, educational institutions, and public organizations are working to mandate.
Yeah, so I mean, subgroups within the system are doing it, and maybe that's as good as we can or should get right now for the reasons that you mentioned.
Absolutely. And I do think businesses, like when you look at some of the business approach, like, okay, what is this going to cost us as a business? Let's just say, let's say even the healthcare business. What is it going to cost us if you get COVID, if you're out of work, if you need to quarantine? And so now that there's a prevention, if you say, we're not going to pay for your time off if you get COVID, or we're not going to pay for whatever you want. I mean, you can change that mandate. Now, is that fair or not fair? I don't know how you want to do that. But then you look at places like Delta Airlines, like, we're going to add $200 to your coming out of your pocket for health insurance and coverage because of the cost to us. And so I think businesses are looking at the cost to them financially. Schools are looking at the cost to them from an education perspective, and the cost to our children and their exposures, and that type of thing. And I do think that is going to help tip this balance towards more people getting vaccinated.
Or at least behaving more safely. That is the alternative. If you just can't convince yourself that you ought to get vaccinated, then remember that all those traditional things that people did before there was a vaccine are simply more important for you even than they are for the next person. I've gone back to wearing a mask for most, like if I go grocery shopping or things like that. The gym I go to is very sparsely populated, so I haven't been there, but I might. I mean, all of us are, and I'm vaccinated, but it's just that, the risk hasn't dropped as much as we expected it to. So I've readapted some of those safety measures, and
Right.
partly out of respect and to model for the people around me, and partly because, the danger is still there.
Yeah, no, absolutely. It's funny because like my 15-year-old is the best, but she never forgets a mask. She's never not gone with, because she just got so comfortable with putting one on. It's just what you do.
I was part of a team that lobbied the New Mexico state government at that time for seatbelt laws. And still, I wasn't great about seatbelts. And the reason I'm now conscientious about them is because teenagers kept insisting on it. Teenagers kept scolding me for not being conscientious enough about seatbelts. So tell Nicole that I said thank you.
I will. Everybody's wearing helmets with horses. I never wore a helmet, and then I got bucked off, and my daughter rode up. They always wore helmets. Rode up. And said, you need to promise me you wear a helmet. I looked up. Okay.
Yep. So good for them. Good for them for making us live up to our own talk.
That's right.
We're coming up on 45 minutes. As Toby mentioned, I'm okay with a bit more, but I don't want to burn up too much of your time either. Are there things we didn't get to tonight that you would like to make sure we touch on?
No, I think we've touched on the points that I felt were most important. I really have enjoyed this, and I really appreciate you giving me the opportunity to speak about this.
Oh, I thank you for your time. And I bet the people listening now understand why I said you're one of the people I admire so much. Thank you very much today.
Thank you.
What's New in Health and Medicine with Dr. Coffee Brown, video and podcast, is produced by Shelley Carney and Toby Eunice from the AGK Media Studio in the Land of Enchantment. Please take a moment now to subscribe and leave a great review. Then share this podcast with your family and friends so they can help heal the planet and improve their health too. Thanks for listening.